Our pledge to the Kenyan people. Our manifesto clearly states on how our citizens will benefit under a people's-led government, run by Alliance. We have identified setbacks and available solutions as stated. On healthcare, challenges identified, weak governance, management structures, hence resource losses, limiting sectors' growth, resulting to low utilization of health services by communities, poor logistical and cultural barriers that affect health sector, high cost of availability and accessibility of services act as a barrier to many Kenyans. Centralized system refusing to channel resources of the county, quelling inequities in resource allocation, equipments offered on loan hindering sector's growth, weak implementation of policies, strategies, guidelines in health sector, thus poor quality services and unscrupulous providers preying in health sector. Donor-driven priorities which do not respond to the country's health needs as outlined in key policy documents and the Constitution. Low-paying and poor working condition, driving staff to the private sector and other countries. Health strikes resulting to poor and vulnerable suffering due to this. Poor infrastructure and long distance to health facilities such as roads, health facilities, medical schools that discourage health staffs going to hardship areas. Limited facilities for providing specialized treatment which forces most patients to seek treatment in other countries such as India, South Africa, and the UK. Lack of adequate investment in the sector to expand health facilities, education facilities in health sectors, thus less staff to overcome the challenges. Lack of a social insurance scheme for all Kenyans, such as National Social Health Insurance Plan. NHIF plan does not cover all health issues. Institutional and logistical weaknesses which hinder distribution of medicine, staff, resources, limiting access to marginal communities and other parts of the country. Inadequate health supplies, thus frequent stockouts in health facilities. High poverty among women, youth, persons with disabilities, denying them health services. Haphazard implementation of life skills education among youth, women, Kenyans, both in and out of schools. Example, lack of first aid services. Cartels and health staff running parallel facilities, supplies of materials, thus denying services to the citizens due to lack of accountability and transparency. Land grabbing of health land, thus lack of expansion of housing, hospital, and learning facilities in the field. Our solutions: a government that offers free and affordable primary health care for all Kenyans by increasing health, financing, and dispersing funds to the county level. Increase the number of physical facilities at community level and increasing mobile health clinic services. Reform the NHIF to uproot corruption and bureaucracy to ensure accountability, transparency, and efficiency by transforming service to all Kenyans. Upgrade and equip provincial hospitals to referral hospitals, supported by a network of county referral facilities and community-level public health centers. Encourage private sector investment in healthcare to offer better services to all Kenyans. Establish fully fledged low-cost diagnostic centers and provide adequate screening and treatment facilities in chronic and terminal conditions in every county. Ensure improved pay packages for doctors, nurses, and other health practitioners to avoid strikes. Promote medical research, including indigenous medicine, and encourage Kenyans to eat local food. Example, cassavas, yams, pumpkins, and vegetables. Promote e-health as a strategy to reach remote and marginalized areas with health services. Establishment of youth-friendly services in all health facilities and strengthening the school health program to support preventive measures and health promotion. Ensure enforcement of the health sector code of conduct to ensure efficient use of resources by all players. Increase budgetary allocation to the health sector. Improve the staff capacity. terms of service, equipments, innovation and research, and investment in preventative health, environment, awareness, and disposal of biomedical waste. Investment in infrastructural improvement with an initial focus in marginal areas to ensure access to health services and to attract qualified staff. Implement a no region, no Kenya left behind policy in health to ensure equity in access to all Kenyans. Establish robust outreach services, bringing healthcare to all Kenyans. Recover the grabbed land and use it to expand health facilities and services to the common mwananchi. With these goals in mind, we and the support of all Kenyans are determined to ensure the vital changes and reforms which Kenyans so urgently need and deserve. Join us, change and reforms. Vote for NASA, vote for Kenya. Nairobi TB.